Now let's see the axillary vein. The axillary vein as the accompanying structure with the axillary artery, it is going to commence at the level of the lower border of the teres major muscle. So here the axillary vein is going to form, and this axillary vein it passes upward and reach up to the outer border of the first rib, and beyond it it is going to be continue as the subclavian vein. This axillary vein it is the continuation of this basilar vein, and this basilar vein along with the two vena comitants around the brachial artery, they fuse, and these three veins together going to form the axillary vein. So the axillary vein, it starts from the lower border of the teres major muscle up to the outer border of the first rib. Axillary vein, it is accompanied by the axillary lymph nodes around its tributaries, and I have made one separate video regarding the axillary lymph nodes, and you can see it in my content. So the major tributaries of the axillary vein are this lateral thoracic vein and the subscapular vein. This axillary vein do not have the axillary sheath around it for the better expansion during the venous return. In some book, though in some book it is written as this axillary vein, it is surrounded by the axillary sheath, but the axillary sheath around this axillary vein is very thin, and that's why there is a little resistance to the venous return of the axillary vein. Occasionally, a axillary arch is present, a muscular band is present from the latissimus dorsi to the pectoralis major muscle or deltoid muscle, or we can say coracobrachialis muscle, which we have already dealt with the latissimus dorsi muscle in the superficial muscles of the back, which will give rise to the compression over this axillary vein, and that may lead to the axillary vein thrombosis, which is of the clinical importance. So this is all about the axillary vein. Hope you understand well. Thanks for watching.